There are a lot of subjects. What I have taken today is physiology. You may ask, why this subject when other subjects are there? See, we are going to treat people, patients. We are going to correct diseases, bring back the people to normal. When I say normal, you should know what is normal. Because a disease or a disorder is nothing but an abnormality. To know the abnormal things, you should know the normal things. When I say normal, there are two things. One, appearance, a normal appearance. Second, function, a normal function. A person, an organ, whatever it may be, they have their own look. Appearance. The study of appearance, their measurements, their locations, their relationships, their blood supply, the nerve supply, all these things is dealt with anatomy. Function is very important than appearance. In studying the function of an organ, you need understanding and you need analysis, some calculation. All these things are there. Unless you know the normal function, you cannot find this is an abnormal function. So the study of normal function is physiology. So everyone should know first what is the normal function of an organ, of a system. And finally, what happens? All these systems combine together for the survival of the person. They do their work. Every organ has got their own work. And finally, all these organs work for the person or the human being. So we need to know the functions of every organ, normal functions. The study of normal function is physiology. Then you will ask, what is the study of abnormal functions or abnormal appearance? Combined together, you have pathology. Pathology is a study of abnormalities, either appearance or function. Fine. Now you know normal functioning, physiology, abnormal appearance or abnormal function, pathology. Now you will ask how to bring an abnormal to a normal thing. Fine. Now, to bring back to the normal function, you are administering some drugs. And this drugs, the study of these drugs, medicines, therapy, the effects, the defects, side effects, all these things, they constitute the subject pharmacology. So now you have three different subjects: normal function, physiology; abnormal function, pathology. To bring a pathology into a physiology, in between you have pharmacology. Every subject is important, but where to start? Where to start this? We always start from normal things. We always study about normal things first. That is why I have chosen this subject to make you understand what is normal functioning of the human body, the human systems, and the organs belonging to the systems, the tissues, and the cells. Everything. We study about these things. So don't you think you should start with physiology? Yes. Well, now having said about this, let us start from the basic thing. The first thing is, what is a disease or a disorder? If I say a disease, mostly it refers to infectious diseases. Dis-ease. The opposite of ease is dis-ease. So when somebody is not easy, when the feeling is not easy, you call it disease. Disease can be an acute communicable infectious disease, which is caused by organisms, or a disease can be chronic, long-standing, for years, throughout life sometimes, non-communicable, non-infectious. You will not infect others. You call these diseases chronic diseases. And most of the chronic diseases, we can say, it's a result of some disorder actually. For example, diabetes mellitus. It's a disorder of metabolism, a disorder of glucose metabolism or carbohydrate metabolism. So you have two things, disease and disorder. So what happens for a person to get a disease or disorder? What is the real thing before that? The body has its own defense system and it has its own balancing system. The defense system is your immune system. It will prevent the organism. It will prevent infection. The balancing system is very important because any change we'll try to balance. When you are going to fall down, you try to bring back to your body to your original position. That is also balancing. Emotional balancing, anxiety, depression, anger. When you get that, you also make yourself to bring back to normal. You call it emotional balance. So balancing is very important. When does this occur? When there is a problem outside and inside. When there is a deviation from normal things, the body will try to bring back to normalcy. Any abnormal things, the body will try to make it bring back to normal. Suppose the environment is very cold. You are in a hill station. What do? You are wearing a sweater and you are covering your body with some extra clothes. You are having a cap and finally you sit squatting. Why? You don't want to lose internal temperature. This is what you are doing. What the body does from inside is you start shivering. So shivering you are not doing, but you are made to do. All these mechanisms, what you are doing, what the body does, is to bring back to normal temperature, if not outside, at least inside. Because the organs which are inside your body, they need a balance. They need a particular temperature, for example, here. Then only they can survive, they can do their work. So you are doing something, the body is doing something. So this type of compensatory mechanism is very important for a body. Many diseases occur only when this compensatory mechanism fails. Fine. What is this compensatory mechanism and how it is done? And what is this balancing activity which is happening inside? That is the main thing we should know first. So this particular balancing inside the body, maintaining an equilibrium, an internal equilibrium, an internal balance. You have a wonderful name for that, homeostasis.